Welcome. I am Terry Tropin, and today I'm presenting a lesson on ICD-10-CM coding for Z codes. Formally, this section is called Factors Influencing Health Status and Contact with Health Services, but since all the codes just begin with a Z, it's easier just to say Z codes. First, let me introduce myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an AHIMA-approved ICD-10 trainer. I've taught healthcare information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external cause coding. These are available on Amazon. When do you use Z codes? Well, sometimes a Z code indicates why the patient is being seen. In fact, the bulk of the discussion in this video are for these Z codes. Z codes may be used as a reason for an encounter for circumstances when the patient isn't sick, injured, why is the patient here? Well, you have a Z code because, of course, you always have to have a diagnosis and a procedure or encounter code. The patient may or may not be sick. Some of the reasons patient may be seen when they're not sick is to receive limited care or service for a continued condition, to donate an organ or tissue, to receive a prophylactic vaccination such as a COVID shot, or discuss a problem which is in itself not a disease or injury, such as, can you help me quit smoking? Can you help me lose weight? Another reason that people may be seen using a Z code, patient has some circumstance or problem which influences the person's health status but is not in of itself a current illness or injury. This might be the patient is homeless, the patient is illiterate. This will impact their health care. If they're homeless, they don't have a safe place to recover. If they're illiterate or have problems reading, then they might not be able to read the instructions on taking their medications or for follow-up care, home care for a wound. The important thing to remember is that even though some of these sound like procedure codes, these are diagnosis codes. So they must be matched with a procedure code to indicate what happened during this encounter. Another area of confusion with Z codes is sequencing. In the guidelines for Chapter 21, Guideline 16 is a list of Z codes that can only be reported as principal or first listed codes on a claim. However, there are exceptions. If there are multiple encounters on the same day or medical records are combined for the encounters on that day, you may have several Z codes that are on the first listed list, but of course you can't do two on as first listed, so you get to choose one. So also if there's more than one Z code that meets the definition of principal diagnosis. So throughout this discussion, I will say these codes can only be listed first, but remember this caveat, this exception that's here. So be sure and circle or tab the Coding Guidelines 16 for Chapter 21 on the codes that must be listed first, except under these circumstances. See this citation here. This is for the guideline that the slide is referencing, and you will see these throughout this presentation. So these are the categories of Z codes that I will talk about today. Reason for a problem addressed during the current encounter. So what happens during the current encounter? Maybe the principal reason the patient is being seen or not, but it's first is something that happened this encounter. There are also family history and personal history codes and status codes. These may not be the reason the patient is seen, but they will affect the way that the patient will be treated, and also socioeconomic factors like the homelessness and illiteracy. These are important Z codes, but these are not part of this video. Maybe the next one. So here are some codes for categories of Z codes that indicate the reason the patient was seen. So we have routine exams, meaning the patient's not sick, but they're coming for their annual exam or a well baby check or something like that. Administrative, such as for to get a life insurance, for observation, for follow-up, aftercare, and screening. Patient may also be seen for because they had possible contact with the disease and they want to be checked. They may be seen for a vaccination, obstetric services, and some types of surgery are also reported with a Z code. So let's look at routine administrative and post-procedural exams. These are Z00 to Z13. Sometimes during a routine exam of a patient without a diagnosis, and that's what these codes are for, is no diagnosis, and yet during the exam, the provider finds something. So there's a guideline for this. List first the Z00, Z13 code, and then you list a code for the condition that's found. The reason the patient is being seen is the examination. What they found during the examination is the condition. So these codes are listed first. Let's look at these. Z00 to Z04 are used for routine and administrative exams. Patient is not being seen to diagnose a suspected condition or treat a known condition. Examples are annual well woman exams, well baby checks, things like that. Most of these codes are listed first. You'll see down here. Whoop. But there's an exception. Z00.6, exam and clinical research program. This is for normal comparison and control for a clinical research program. So that is listed first. That's the reason the patient was there. Remember, these are not used if there's a suspected condition or to treat a condition. It's just a routine exam that's part of monitoring a patient's health over the long term. Codes in category Z01, encounter for other special exams without complaint, suspect, reported diagnosis, are always listed first. Codes for pre-procedural exams, Z01.8, are used to indicate a patient will be having surgery. The surgeon has requested clearance for the patient, a check for the patient to make sure there are no potential problems, and the patient will be okay to take the to have the surgery. These codes are listed first. This is why the patient is being seen. Note that this is a clearance. No treatment for the condition is provided during this visit. If any treatment is given, then you don't use the Z01.8 codes. Encounter for medical observation codes are category Z03. These are used for observation of suspected disease, for suspected disease and conditions, but the condition after observation is ruled out. The physician says, we thought they might have this, but they don't. In this case, the patient is put into observation even though they have no signs or symptoms of a condition. Why would they do that? Well, exposure to biological agents, maternal and fetal conditions, or ingested or inhaled foreign body. These are some of the subcategories in CO3. Don't use these codes if the patient has a confirmed condition. Remember, we said ruled out, no signs or symptoms. Those are requirements to use these codes. You don't use these codes if the patient has an illness or signs or symptoms related to a suspected condition. Signs or symptoms. So list it instead for what's wrong in this case. There's another observation category, Z04. Codes in this category include observation after transport accidents, alleged rape, psychiatric exam requested by authority, alleged physical abuse, or the victim of forced labor or sexual exploitation. These codes are listed first. You see from the previous ones, may or may not for Z03, listed first for Z04. That's one of the things that's really confusing about Z codes. When is it listed first? When is it not listed first? And that's going to be a theme throughout this presentation. Categories Z08 and Z09 are used for follow-up visits. These codes are used when treatment has been completed, there's no sign of disease, nevertheless, physician sees the patient for an exam to make sure that it has not reoccurred. The best example of this would be a cancer diagnosis. Even after the patient was successfully treated, the physician will want to see the patient every few months, then a couple of times a year, to make sure the condition has not reoccurred. Additional codes may be used to complete the full picture of the patient's condition. Codes may include acquire absence of organs if the treatment for the condition was to remove something. Also might do a code for personal history. These may or may not be listed first. If the patient is seen for another reason and while he or she is there, the physician checks on the cured condition, the primary reason for the visit is listed first. Follow-up codes are not used under these circumstances. They're not used with injury codes. You'll remember that injury codes have a 7th digit, a final digit for subsequent encounter. If you have an injury code with a 7th digit for subsequent encounter, that means the injury is still being treated. Remember, follow-up codes mean that the patient is cured, no more treatment for the condition. Now, sometimes, unfortunately, a physician will see a patient for follow-up, will discover that a condition has reoccurred. In this case, code for the condition that has reoccurred, not the follow-up codes. So follow-up codes are used to follow up on a previous condition and no reoccurrence has been found. The next codes are for aftercare. These are defined as care following the initial treatment. This may include change or removal of wound dressing, removal of sutures, change or removal of drains, post-procedural wound closure. So these are continued care after the initial treatment. The condition is still being treated. These may or may not be listed first. So aftercare codes, these are coded in category Z48. List this code first when the aftercare was the reason for the encounter, why the patient came in. List as an additional code when the encounter was for some other reason and aftercare was also provided. Again, you're not going to use these with injury codes where there's a 7th digit for subsequent encounter. In that case, use only the injury code. So for orthopedic and injury aftercare, this also follows the rule, the previous rule concerning 7th digits. If the original code used for the injury includes a possible 7th digit for subsequent care, use the original code and not an aftercare code. This is also true for other post-procedural aftercare. So if there's a possibility of using a 7th digit, don't use aftercare, use the original injury code. Sometimes people are confused about whether an encounter is an aftercare or a follow-up visit. Remember that aftercare means the patient is in the process of healing or recovering from a condition. It's not gone. It's still there, but the initial visit took care of the main part of it, and now they're kind of following during the healing process. In follow-up codes, treatment has been completed, no treatment for the original condition. Categories Z11 through Z13 are used for screening visit. Be sure and differentiate between a screening test and a diagnostic test. A screening test means the patient has no signs or symptoms of the disease, but they're being seen to screen for early detection. An example of that might be a pap smear, for example, a pelvic exam, for example, screening for a neoplasm. A diagnostic test, the patient does have a sign or a symptom of the disease, and the patient is being tested to see if they have the disease or not. So screening test, no symptoms. Diagnostic test does have signs or symptoms. These may or may not be listed first, depending on why the patient was there. List a screening code first if the reason for the visit is specifically the screening exam. Lead another code first and the screening code as an additional code if the patient was seen for some other condition and while they were there they said, hey, let's do the screening. You still list the code, but it's not listed first. So it comes back to the basic rule of why was the patient here. A patient may also be seen because he or she had contact with or exposure to a disease. These codes are used when the patient has no signs or symptoms of the condition, but may still be at risk due to contact with or exposure to. If the reason for the encounter is for testing for the condition, list a Z20 code first. Again, if the reason for the encounter is for another reason, the physician also performed a test, then code first for the other reason. A patient may also be seen because of contact with hazardous materials, not exposure to a disease, but exposure to other materials such as lead, asbestos, mold, or environmental tobacco smoke. There are very specific codes for these. List these codes first if encounter was for the testing, if that was the reason the patient is being seen. List these in an additional code to identify potential risk. Categories Z23 and Z28 are used for encounters including vaccination. Note the reasons that the vaccinations were not given. So Z23 vaccination was given. Z28 vaccination not given. This is important information. Z28.0 contraindication, Z28.1 reasons of belief or group pressure, Z28.2 other and unspecified. Also very important is Z28.3 under immunization status. This tells the physician this patient is behind on their immunizations and need to catch up. If the patient is seen only for the vaccination, list these first. Otherwise, list another appropriate code first. Often these are done with annual exams. So you have an annual exam code and then an inoculation code, and that tells everything that happened during the visit. Category Z33 is used for pregnant state. Some of the codes in this category are never listed first, while others may or may not be listed first. This is one of those confusing sections. So may or may not be listed first. Z33.2, elective termination of the pregnancy. The patient may have a condition or that gives them the need to terminate the pregnancy. Z33.3, gestational carrier. They're carrying the baby for someone else. This code can never be listed first. Pregnant state incidental, Z33.1. It is important, she comes in for a condition unrelated to the pregnancy. It's important to note she is pregnant since it may affect the treatment given, but that's not why she's here. For example, a pregnant patient may trip and sprain an ankle. The reason she's being seen is the sprain. A code for pregnant state incidental is listed as an additional code. Obstetrics obstetrics and related conditions are in category Z34 to Z39. So again, some of the codes in this area are first, some of these codes are never first. So supervision of normal pregnancy, Z34. So this is for the pregnancy visit. They do the size check, and they do the urinalysis and weight, all of that, but there's nothing really wrong. So you have to have a diagnosis for that. So this is what you do, Z34. Live-born infant's place of birth and type of delivery, Z38, that's always listed first. Encounter for postpartum care, always listed first, Z39. On the other hand, these codes are never listed first. Weeks of gestation and outcome of delivery. So it's going to be something else. And particularly in weeks of gestation, she's there for this reason. She may be supervision of pregnancy, and then as an additional code, they note weeks of gestation for the patient. Encounters for other surgery. Some encounters are for prophylactic surgery, such as cosmetic surgery, something that is not necessarily medically necessary. These are in Z40. Patient had risk factor for malignant neoplasm and elects to have organs removed before the neoplasm develops. So a woman with a family history of breast cancer, her mother, her aunts, her sister, may say, I know that the odds of me getting breast cancer also are very high, so let's just remove them. So that's Z40, prophylactic. I'm sorry, that's not cosmetic surgery, it's prophylactic surgery. These codes are listed first. This is the reason the patient was seen. Encounters for attention to artificial openings is Z43. This is an artificial opening surgically created during a previous encounter. Tracheostomy or colostomy are examples of this. During this visit, the provider cleans or checks the opening to make sure it's functioning correctly. If there is a complication of the opening, don't use this code. Use a code for the complication instead. So if it's a routine check, opening check, then it's Z43. Otherwise, do the code for the complication. Categories Z44 to Z46 are used for fitting and adjustment of device. For example, Z44, external prosthetic device. Z45, implanted device. Z46, other devices such as hearing aids or gastric lap band. These codes include removal and replacement of the device. If removal or replacement is due to a complication, you're not going to code these, you're going to code a complication instead. So this is routine. The important word here is routine removal and replacement. And they may or may not be listed first depending on the circumstances. Encounters for renal dialysis. A code for end-stage renal disease is also coded as needed. So Z49, encounter for renal dialysis, code for end-stage renal disease. Again, was this the reason the patient was seen, or was the patient seen for something else? And then you also received renal dialysis at the same visit. C51 is used for aftercare and medical care. These codes are encounter for radiation therapy, encounter for antineoplastic radiation therapy and immunotherapy, chemotherapy. You use an additional code for condition requiring care. So for example, these codes are listed first. That's the reason the patient is being seen. So if the patient is being seen for chemotherapy, right, list first chemotherapy, then list chemotherapy for what? Where was the neoplasm? So a more specific code. And that again will give you the whole picture of what's going on here. Category Z51 also includes codes that may or may not be listed first. The ones we talked about before must be listed first. These may or may not be listed first. Z51.3, adequacy testing for dialysis, palliative care, desensitization to allergens, other specific aftercare. So these kinds of care these codes may or may not be listed first, depending on the circumstances. Sometimes a patient will come in for a procedure and change their mind, or there may be other reasons that the procedure is canceled. These are important Z codes to indicate why the planned procedure was not performed. You're going to list first the reason the procedure was planned in the first place. For example, a patient was going to have a surgical procedure, changed her mind, and walked out. Use code Z53.21, procedure not carried out because of patient leaving prior to being seen by a provider. So that gives the whole picture. Note this last code. It's in this category, but doesn't really seem to fit in with the other ones. Procedure converted to open procedure. The code is used when a planned endoscopic procedure must be converted to an open procedure. This is the last of the Z codes used to indicate what happened during the encounter. Now let's move on to Z codes to indicate history. We'll start with personal history. Personal history codes are used to indicate a patient's past medical condition that no longer exists, not being treated, but has the potential for recurrence and therefore may require continued monitoring. If the documentation simply says history of, we're going to assume that that's personal history. These codes are most often used with follow-up codes, but they can be used with any other code as appropriate, because the fact that the patient has a history of something may affect current care of whatever condition they have at this point. There's a note under follow-up code categories Z08 and Z09, use additional code to identify history, if appropriate. I love this picture. Category 85 indicates the patient has a history of a malignant neoplasm. The neoplasm has been treated and the patient is considered cured. For a visit for surveillance for possible reoccurrence, you're going to list first a follow-up code. Now, these codes can also be listed as secondary codes when the patient is seen for another reason. But also a lot of additional codes for risk factors. And that's why I had the smoking skull. Basically, alcohol or tobacco use or exposure or dependence. Here's some more history codes. Z86, certain other diseases, like neoplasms that are in situ, benign, or uncertain, and for other conditions. Z87 includes other diseases of specific body systems, like disease of the respiratory system, disease of the digestive system. So in this case, you're going to list first any follow-up exam after treatment has been completed. Here's some more personal history codes. Note that Z91.1, non-compliance with medical treatment, includes a note to list an underdosing code if appropriate. So indicating non-compliance is really important to the physician and to subsequent physicians. And if it's underdosing, if the non-compliance is not taking all of the medication, you're going to list first the T code. Wandering, Z91.83, specifically says code first underlying diseases. So you're not going to do the wandering as the primary diagnosis. For example, for Alzheimer's disease, you're going to list Alzheimer's disease and then wandering. Family history codes, on the other hand, indicate that a patient has a family member who has had a particular disease that causes the patient to be at higher risk of also contracting the disease. This may be used with screening codes or any other codes as appropriate. So if the patient's there for screening for this family history condition, you're going to do probably a screening code first. but it can be done with any other codes. It may justify an additional test the patient has, so because they have a family history of a condition. Here's some other examples of family history codes. These conditions in a family member may impact a patient's care. So family history, malignant neoplasm, mental behavior disorders, disabilities and chronic diseases such as epilepsy, blindness, deafness, stroke, other specific disorders, and other conditions. Now let's move on to status codes. In status codes, the patient is either carrier of a disease or has a sequelae or residual of a past disease or condition. It may be simply patient has a pacemaker, patient has an IUD, patient has a shunt. So compare this to history codes. In history codes, patient had a condition but no longer has it. A status code is patient is a carrier or has a sequelae of the condition. These codes may or may not be listed first. So guidelines on using status codes. Do not use a status code with a diagnosis code from a body system if it is related to the status or the status code does not add any information. For example, don't use heart transplant status Z94.1 and complication of heart transplant T86.2. Well, they're not going to have a complication of a heart transplant if they hadn't had a heart transplant status. So doing the status code wouldn't add anything to the story. And heart transplant status implies they have a heart transplant, no problems, complications at this time. Resistance to drugs. Status codes are used to indicate the patient is resistant to antibiotics or other drugs. These codes are not used with code A4902, methicillin-resistant Staph aureus infection, or pneumonia due to MRSA, or sepsis due to MRSA. Adding the resistance codes in category Z16 wouldn't add any information. Again, you don't want to do codes that don't give, oh, they'll give information, okay. So you're going to do Z16 is going to be listed second because first you're going to list the infection first. Patient has condition that is resistant. So that's what's going to be listed first, and then you're going to use one of these codes. Body mass index, or commonly known as BMI. This indicates a patient's weight as underweight, appropriate weight, overweight, or obese. It is determined by the patient's weight in proportion to their height. Now, first you're going to code from E66, overweight, obesity, and then you're going to use the body mass index. So these are not listed first. They're codes for adults and for children. Those are the different ones. These can be documented by non-physician practitioner. These are guidelines. Non-physician practitioners can do these, and you don't use a BMI for pregnant patients. Another status code is used to indicate that the patient is receiving long-term drug therapy. Receiving this therapy may affect other treatments or examinations. For example, antithrombotics, antiplatelets, non-steroidal inflammatories, antibiotics, insulin, steroids, and other. These codes may or may not be listed first depending on the circumstances. Z79 includes long-term drug use for either prophylactic use, preventive, or for treatment. Do not use these codes if the patient is receiving drug therapy for a brief period to treat an acute illness. So this is long-term only. Don't use these for an addiction. Don't use these if the patient is undergoing detoxification or maintenance to prevent withdrawal under an addiction. You may also code therapeutic drug level monitoring, which may be why the patient is being seen. So they say long-term drug therapy, therapeutic drug level monitoring. Here's some more status codes. There are lots of them. Allergy status, Z88, very important to have that noted. Z90, acquired absence of organs, that tells the whole story. You know, they had a malignancy and now they have had a specific organ excised. Personal history of medical treatment, contraception, drug therapy, or radiation, for example. Artificial opening status, transplanted organ and tissue status, that they had a heart transplant, and also Z95, presence of cardiac and vascular implants and grafts. Depending on the circumstances, they can be listed first, but it will depend. So let's look at Z99. Status code category Z99 is used for dependence on enabling machines and devices, and these can be respirators, dialysis, wheelchair, other. So these codes may or may not be listed first. This code is always listed first, and this makes sense. This is a crisis. Z99.12, dependence on respiratory ventilator during power failure. So there are also guidelines concerning Z99.11, dependence on respiration. If the patient is being seen for weaning from a mechanical ventilator, code first the condition that they're on ventilation for, chronic respiratory failure, and then use Z99.11 as an additional code. Artificial opening status. These codes indicate the patient had a surgically created opening, has a surgically created opening such as a colostomy, tracheostomy, but is not being treated during this encounter. It's kind of, oh, by the way, this patient has an artificial opening. Now, this may affect treatment that they have this, but it's not the focus of the visit. So this is Z93. So compare this to Z43. Z93, patient seen for another reason. Oh, by the way, they have a stomy. For encounters for attention to artificial opening, Z43, something is done to the opening. It's cleansed, treated, attention is given to the artificial opening. In Z93, it is not. So sometimes the hardest part of using Z codes is finding them in the alphabetic index. So here's some possible, make yourself some notes in the beginning of the index or the beginning of the Z code section about what to look up, because these are not always the first thing that comes to your mind. So you have absence, admission for, attention to, carrier, counseling, dialysis, encounter for, examination, exposure, history family, history personal, fitting, maintenance, newborn, observation, and status. There is no way someone can remember all the ICD-10 guidelines. It's very important to write notes in your book to jog your memory. You don't want to be thumbing through the guidelines during a test or certification exam. Here's some suggestions. In the alphabetic index, highlight the different history entries, personal and family. It's very easy, since they go on for several pages, to get these confused. In the tabular list, you might want to write in next to the codes that are always listed first. Just make a note of that. Or that are never listed first, that we talked about a lot today. Sometimes it'll say that at the code, but you might want to circle it if it already says that. Also identify the difference between aftercare and follow-up care, and the difference between status and attention to. That completes this lesson. If you have questions or comments, please feel free to contact me. Here are some books I've written on coding. They are available on Amazon. You can use this link, or you can go to Amazon Books and type in my last name, Tropin. So here's how to contact me, and here's how to find my books. Thank you so much for listening. I hope to have more lessons up soon. Thank you.